Hey, you guys. So I went to the doctor's today. I actually saw a general surgeon. We discussed my options, basically, all of my options to avoid surgery. And I was a little heightened making this video earlier in the day, and those are my raw emotions. But I've come to an understanding that SMA syndrome can happen when you have, high stress situations, and when I guess, you're not eating correctly or you're losing weight. They're still doing research into the syndrome if it happens suddenly or if it happens due to stress. But what I do know for a fact is that I was, going through domestic violence. I was going through eviction in 2019, and that's when my doctor diagnosed me with anxiety and depression. And after that, I, most recently have been through job harassment and also, getting fired from that job. And that has caused a lot of stress in my life. So I'm not sure if those things are related to SMA syndrome, but I'm going to work with this dietitian, and hopefully this dietitian can help me to gain weight, and then in turn that will rejuvenate the fat that is supposed to support the arteries that are collapsed on my intestines currently. So let's get into this video. This doctor wants to see me back in 6 months, the doctor that I saw today. I was a bit frustrated with that because I've been trying to gain weight for the past 2 years, and it's kind of like, what is 6 more months gonna do? But I'm gonna give this dietitian a try, and I'm thankful for anybody in my life helping me right now. I'm thankful for this doctor right now helping me. I'm thankful for that vascular surgeon, calling me back because he didn't have to call me back. He definitely canceled my appointment and told me it was nothing that he could do. But then he ended up calling me back, and telling me, hey, like, I'm about to explain this to you. I'm about to, call the general surgeon and explain it to him too. And he told me, he was there to support me. And I really appreciate it. I'm trying not to get emotional again because it's been a long journey, y'all. It's been a long journey concerning my health. And all the support that I can get, like, I really, really do appreciate it. I really do. And I appreciate these doctors, in my life trying for me too, because I know that this is a syndrome that is not researched enough, and that these doctors don't have too much information about. But I am so thankful. I'm so thankful that they are trying, okay? And that they are doing their research. And I'm happy that, I'm happy that I do have this syndrome so that I can bring awareness to it. I've been trying to gain weight for 2 years now. And the doctor, basically told me to gain weight, eat more, gain weight. But when I eat, it comes back up because my intestines is being squeezed by my blood vessels. So anything that I eat, it comes back up. And if I force myself to eat, I can be in bed. If I overeat, I can be in bed for, 2 days, a couple days, in pain, and great pain. So it's painful for me to eat, and I throw it back up unintentionally because I had a doctor ask me if I was bulimic. Unintentionally. And what I actually learned is that I have gastritis, which gastritis can be caused by vomiting, long-term vomiting. So a lot of these doctors look at me as if I'm doing it to myself, as if I'm intentionally throwing up. And that's why I have gastritis. That's why I lost this weight. And that's why there's no fat to support my blood vessels, and it's collapsed on my intestines. But I have never had an eating disorder. And the SMA, the blood vessels collapsed on my intestines, is causing me to throw up, which has caused the gastritis problem in my stomach. All right, that's what I have learned. I've been doing some research. I hope that, these doctors that I'm seeing are not just looking at me as if I have an eating disorder, because I've been a bit, self-conscious with that, going to these different doctors ever since that, imaging technician, told me they didn't think I had SMA, but they thought it was bulimia. So, I take that with a grain of salt, but it really did open my eyes to the different perspectives that people can have of you, especially when they don't know you, especially when they haven't been dealing consistently with your case. So like every new doctor that I see, I make it a point to say I have been unintentionally throwing up because my stomach is in pain. All right? My stomach's in pain when I eat. And every time I eat, I get nauseous and I throw it back up unintentionally. But yes, I'm a bit frustrated because I can't gain weight if I can't eat. But he's put me in touch with a dietitian, and I'm really hoping that I can change my diet in a way that I'm doing high calorie intake and fatty foods intake, and not just, not just lettuce or different things that are not high in calories and stuff. And hopefully this me being able to eat high calorie food that can put weight on me, but I'm gonna try with this dietitian, and I've really been trying hard. And actually what happened was I was supposed to make my follow-up appointment with that same doctor in 6 months, and I left the office because I was about to cry. I'm a crier, y'all. I'm so sensitive. This doctor, he didn't say nothing wrong to me. He just told me that I have to, eat more, or in 6 months, we can be looking at and talking about the possibility of a feeding tube if I don't gain weight. So that way, I can get those calories in me and I can gain weight to hopefully get, the fat in, to help the blood vessel to be held up. I don't know. Like, this is a journey, y'all, and I'm trying not to cry right now. I guess I see, what can happen in the next 6 months. But I've been reading online about SMA, and it says, it can get worse over time. And I guess it can get worse if you're not gaining, if you continue to lose weight. I don't know. I'm still researching about the disease or the syndrome, because it's not a disease, it's a syndrome. So I'm still researching about the syndrome and what I can do. But yeah, I guess I'm gonna start forcing myself to eat. I don't know. I guess I'm gonna have to be in pain for a little bit. But I mean, what happened was in 2019, I started throwing up out of nowhere. Like, I had weight on me and I started throwing up out of nowhere. So I'm not sure if SMA just happens out of nowhere. I've read that, some people lose weight and then it develops, but I was at a healthy weight when I started throwing up unintentionally. I was at a healthy weight. I started having stomach pains out of nowhere. So I'm not too sure if me eating more and gaining weight is going to reverse the SMA. But that is what this doctor is telling me. So I'm going to try. I'm going to try my options. When a doctor spoke to me and explained SMA syndrome to me, this was actually a vascular surgeon and he deals with the blood vessels, but he explained to me that he is not able to take me as a patient concerning SMA syndrome because he is a doctor who would, remove blood vessels and stuff. And obviously this is, my major artery. And yeah, I don't know. He just said he couldn't do it. He told me that I would have to talk to a bowel surgeon, somebody who operates on the bowel. I talked to this doctor that I just went to today, and he told me that he would not be able to put a tube in my intestines to hold my blood vessels up. This is how normal intestines supposed to be. This is how mine is. And these are the 2 blood vessels right here. So I asked if he could insert a tube to, hold open my intestines, and he said no. He does that for cancer patients, who have a few months to live, because actually what happens is if he was to put a tube in my intestines, it would be, it would create blockage, I guess. And then, there would be more surgeries to unblock it or something. I don't know. I'm not a doctor. I'm just telling you guys what I was told. But yeah, so besides that option, my next option would be, operating on my intestines, basically taking my intestines away from those 2 arteries, I'm putting it in a different position or something like that, so that it's not being squeezed. And I'm gonna keep on, researching more about SMA. Hopefully I can get in contact with more people who have SMA, so I can know what their symptoms are and what their treatments were and what their journey is. If you guys know anybody who has been going through this, if you guys can, get in touch with anybody, please leave a comment below, please, so that I can know your story and what you've been going through, and we can bring awareness to this together, because I found one person going through similar stomach issues as me, but they have not been diagnosed with this. But I would absolutely love all the support. Like, I'm so thankful for her and her support, and I really feel like we connected at the right time. But yeah, y'all. Yeah, it's frustrating. It's a frustrating process.